Welcome to Heart Attack Awareness. Before we dive in, make sure you hit that subscribe button so you never miss a life-saving truth about your heart. Today's episode might shock you. We've been told for decades that low cholesterol equals a healthy heart. But is that the full picture? Not even close. In fact, millions of people with normal or even low cholesterol levels have suffered fatal heart attacks. Why? Because cholesterol is only one piece of the puzzle, and relying on it alone can be dangerously misleading. Let's start with a story. Alan was 63, healthy weight, non-smoker, and proud of his cholesterol score. Total cholesterol of 178, LDL of 90, HDL of 52. His doctor called his labs perfect. Yet, Alan suffered a heart attack while gardening. He had no warning signs. He exercised. He ate well. But the ER cardiologist said something that changed everything. Your numbers look fine, but your arteries don't. A scan revealed severe plaque buildup. So what went wrong? The answer is that the standard cholesterol test, the one most people get during their annual checkup, only tells part of the story. It measures total cholesterol, LDL, bad, HDL, good, and triglycerides. But it doesn't measure inflammation, particle size, or other hidden markers that can make or break your heart health. And that's where the myth begins to crumble. Let's unpack LDL cholesterol, often called bad cholesterol. Turns out, not all LDL is created equal. There are large, fluffy LDL particles that are less harmful, and small, dense LDL particles that are more dangerous. Why? Because small LDL particles are more likely to slip into the artery wall, get oxidized, and trigger inflammation, which leads to plaque buildup. But guess what? Your standard LDL test doesn't tell you which type you have. You could have a normal LDL level, but a high amount of the dangerous small particles. Then there's the role of oxidized LDL. When LDL particles interact with free radicals from stress, poor diet, smoking, or environmental toxins, they become oxidized, which is when they start damaging blood vessels. Oxidized LDL is highly atherogenic, meaning it promotes plaque formation. Standard cholesterol tests don't check for this either. Let's also talk about Lp(a), short for lipoprotein A. This little-known cholesterol-related molecule behaves differently from LDL. It's sticky, inflammatory, and strongly associated with atherosclerosis and early heart disease. The problem? Lp(a) levels are mostly genetic, and most doctors don't routinely test for it. Up to 20% of the population has elevated Lp(a) and doesn't even know it, despite having good cholesterol. Another major factor is inflammation. A landmark study, the CANTOS trial, showed that lowering inflammation, even without changing cholesterol, reduced the risk of heart attacks. This means that someone could have low cholesterol, but if they have high C-reactive protein, CRP, they're still at serious risk. Inflammation weakens artery walls, making it easier for cholesterol, even low levels, to form plaque. The American Heart Association has even updated their stance. It's not just about cholesterol. It's about your overall risk profile. That includes blood pressure, age, family history, blood sugar, inflammation, and more. A cholesterol number in isolation doesn't give the full story. Let's look at more real-world cases. Susan, 58, had a total cholesterol of 165 and perfect blood pressure. She even meditated daily. But a coronary calcium scan, a test that measures plaque in the arteries, showed a score of 320. That's considered high risk. She had no symptoms, no family history, and yet she was a ticking time bomb. Her doctor had never ordered that scan because her cholesterol looked normal. This is why we must go beyond traditional cholesterol tests. The coronary artery calcium (CAC) scan is a simple CT scan that detects calcified plaque in the arteries. A score of 0 means you're likely safe. But once the score starts to climb, even in the absence of high cholesterol, your heart attack risk skyrockets. The CAC scan is one of the best predictors of cardiac events we have, and yet it's rarely offered unless you push for it. So why has cholesterol been so overemphasized for so long? It goes back to outdated research and pharmaceutical focus. Statins, cholesterol-lowering drugs, became a multi-billion-dollar industry. And while they do reduce risk in high-risk populations, they're not a magic bullet. Some people on statins still suffer heart attacks because their root problem wasn't just cholesterol, it was inflammation, blood sugar, poor sleep, or genetics. There's also the issue of triglycerides. These fats in the blood are often elevated due to poor diet, excess alcohol, or insulin resistance. High triglycerides combined with low HDL is a strong predictor of cardiovascular disease. So someone could have low LDL but high triglycerides and still be at risk. Again, this nuance is often missed. And let's not ignore insulin resistance. It's one of the most underdiagnosed conditions in people over 50. When your body becomes resistant to insulin, your blood sugar stays elevated, damaging blood vessels and fueling inflammation. It's often the root cause of metabolic syndrome, which includes high blood pressure, belly fat, high triglycerides, and low HDL. You could have low cholesterol and still be living with metabolic syndrome and not know it. Let's now focus on what you can do. First, get the right tests. Ask your doctor for a C-reactive protein, CRP, test, a coronary calcium scan, and a lipoprotein A test. If possible, get an NMR lipoprofile to assess your LDL particle size. These give a much clearer picture of your risk. Second, shift the focus from just lowering cholesterol to reducing inflammation and oxidation. That means a Mediterranean-style diet rich in antioxidants. Berries, leafy greens, olive oil, nuts, garlic, turmeric, and fatty fish. Reduce processed foods, fried items, sugar, and refined carbs. These are the real enemies, not cholesterol alone. Third, manage stress. Chronic stress raises cortisol, blood pressure, and increases oxidative stress, all of which inflame arteries. Incorporate deep breathing, meditation, walking in nature, or journaling into your day. A calm nervous system supports a healthy heart. Fourth, optimize sleep. Poor sleep leads to higher inflammation, poor glucose control, and even higher cholesterol. Aim for 7 to 9 hours and get tested for sleep apnea if you snore or feel tired despite sleeping. Fifth, get moving. Physical activity doesn't just help burn calories. It improves endothelial function, increases HDL, and helps your body use insulin better. Walking 30 minutes a day can dramatically lower cardiovascular risk, even if your cholesterol doesn't change. Let's finish with a reminder. Your heart is not just a pump. It's a reflection of everything happening in your life. Your relationships, your diet, your environment, your stress. They all leave a fingerprint. Cholesterol is just one line on the page. Don't stop reading there. Go deeper. Demand the full story. This has been Heart Attack Awareness. If this episode changed how you view cholesterol, hit like, subscribe, and share it with someone who thinks they're safe because their number looks good. Next week, we're busting another deadly myth. Butter is worse than margarine. You won't want to miss it.